Hi friends, this is Dr. Anish Vaknalli. Today let's talk about what PCOS or PCOD is. PCOS is polycystic ovary syndrome. It affects approximately 10 to 15% of women irrespective of their color and race. Uh, so the exact reason why PCOS happens is not known, and usually we attribute it to genetic factors, or it could also be the environment and the levels of stress which have increased and the lifestyle which has changed over the past few decades. What happens in PCOS? So in PCOS, basically there's an increase in the male hormone which we call androgen or testosterone, which is produced by your ovary. This results in an enlargement of your ovary. It leads to improper ovulation, and because of the failure of the egg to release from the ovary, it forms a cyst. This leads to infertility, irregular periods. It can also cause acne. There can be facial hair, which is usually on the upper lip and the chin, which is called hirsutism. There can also be obesity, and a lot of women also have something called insulin resistance, which means there is an elevated level of insulin in your blood, which also leads to obesity. Okay, so how do you diagnose PCOD? So basically, you will obviously know that your periods are going to be irregular, or sometimes they may not be very irregular, but on a sonography, you will see like a pearl, like a string of pearls, we call it, where you see a number of follicles, which are usually on the periphery of the ovary. Uh, this comes in a sonography. Your blood reports will show elevated levels of the male hormone. Insulin could be high. There could be elevated levels of LH. And usually, just by the signs and symptoms, we are able to figure out whether you have it or not. Okay. Now, once you have been diagnosed with the PCOS, what is it that you can do? So most women will definitely go to their gynac. The gynac will suggest, get a blood test done, get the sonography done, etc. And usually birth control pills, which help in regularizing your periods, is given. However, it's an artificial way of getting your periods regularly. And more than often, on stopping them, you come back to the same place where you were before. So we normally don't recommend this line of treatment simply because it's a very artificial way of rectifying it and is not a solution or a long-term solution. The earlier you treat PCOS, the better are the results. Said that, it does not mean that if you are in your mid 20s or mid 30s, it does not mean that homeopathy will not help you. Homeopathy helps all age groups. However, the earlier you treat, the better are the results and the quicker are the results. And the longer the effect of the treatment will continue. So as soon as, normally speaking, you do, normally women will come with PCOS either later on in life, when they are more aware of it, but also young, girls who have just started their periods or in their teens also experience this, and you're able to identify this problem. Okay, so the faster you come to a doctor or a homeopath, the better it is for the patient. So how do we treat it? So normally we start with the homeopathic medicine. Now, as I said, that PCOS is a lot to do with the level of stress. So we take a lot of your personality into consideration, the way you handle your stress levels, your environment, and your entire constitution. So we call it constitutional treatment. Okay. So there are specific remedies in homeopathy which work very specifically on the cyst itself in the ovary. We do use those at times as well, but the constitutional treatment works the best. Now, when we start, the duration of treatment is longer than simple conditions like a cold or a cough. It can go on for 6 months. It can go on for a year to sometimes even more than that. Simply because to regularize your periods, it does take time, and to stabilize your hormones. Do we give homeopathy and allopathy together? Usually not. And if we do, it does not serve the purpose. So we completely stop any kind of allopathic medicines that you are on, and and only keep you on homeopathic medicines. Okay. Now, a lot of women with PCOS may also have a lot of cysts, and not small cysts. There can be big cysts too. So even in our experience, even large cysts, like even a centimeter or 2 centimeter cysts, have been cured with homeopathy. So even if you have irregular periods, excessive flow can be less. There can be a lot of pain or dysmenorrhea, we call it. All these kinds of things which are related can be treated with the medicines we prescribe. Okay, so I would definitely recommend homeopathy to be the first line of treatment. Do not run directly to your gynac and start, the birth control pills or whatever treatment they recommend. Start homeopathy as the first line. I'm sure you will benefit. Thank you.